Okay, so I think we are online. Good morning, everyone in Germany, and good afternoon, everyone in India. It's 10 o'clock, or a few minutes after 10 o'clock here in Berlin. It's cold. It snowed a little bit yesterday. I hope the weather is nicer. I'm pretty sure it's nicer in India. And of course, I hope that everyone is well and in good health. So we have really exciting event today, which is actually split in half. We have the demo day of our two latest startup tours, digital startup tours, that we conducted together with partners CTI and CFE International and the GIZ. We have these two startup tours. There are two different themes that we organize. It's Tech for Good theme and also the healthcare theme. And we'll start with the first 1.5-hour session to present the 8 healthcare startups from India in this first session. That will be for the next 1.5 hours, and then we'll have a short break, and then in the second part we'll have the second session with the 12 Tech for Good startups. We are here at the factory in Berlin. We had the Indo-German Startup Week also hosted from here again. So, and we're really excited that we could host today's event again from here. Together with me is Eileen, who is also supporting GINSEP since its very beginning, and she was mainly in charge of organizing the two delegations, and she'll tell us a little more about what we can expect today. Over to you, Eileen.
Yeah, thank you, Julian. Also, a warm welcome from my side. I'm really happy that we have today the final demo day as a grand finale for the two startup tours. We engaged in 2 intensive weeks in the last 1 month with 8 healthcare startups and 12 startups from the Tech for Good space that will today present their pitches to you. But before we start, we will hear 3 speakers from India that are our partners. And then after these speakers, we will have the startup pitches. Each startup from the healthcare sector will pitch for 5 minutes, followed by 2 to 3 minutes questioned from our experts, which we will be introducing to you in a bit. And after that, we have a 30-minute break, and then we will start with the Tech for Good startups.
Yeah, thanks, Eileen. Also very important for you to know, if you want to, if you have questions for the startup, you can make use of Slido through the website. So we will see the questions here, receive them, and we'll ask them as well to the individual startups. But of course, it also depends on the time that we have. But of course, we'll be able to have a few questions here and there. But before we start, Eileen, I would like to know from you, how was the experience from you, from the organizers team, about these delegations? It was the 4th digital delegation that we organized with GINSEP, or GINSEP was part of. What has changed, and what was your experience? Now, aren't people also tired of all these online events, or is it really something that is working really well?
I think it is working really well, because we saw from the startups that they really enjoyed the tours. Also, the program was pretty much mixed. We had a lot of interactive sessions, workshops mixed with presentations. So we tried to keep the startups engaged, and we brought more than 25 partners for each tour on board. Also, every startup had a dedicated mentor that worked with them on their expansion strategy to Germany throughout the week. But not to talk too much longer, I would like to now hand over to one of our guest speakers, who also has been supporting the program. Shankar Kumar is the advisor of GIZ in India, and he will talk a little bit about the importance of Indo-German startup cooperation. So over to you, Shankar, and happy to have you here.
Thanks a lot, Eileen. Thanks, Julian. Good morning to my friends here in India, and good afternoon in India, and good morning in Germany. I'll not take much time, because these speeches, this would not gel well with the demo day, in which all these startups are there, these innovative startups, and they are looking forward after intensive mentorship since last few weeks. So I'm really excited to be part of this program, and I'm actually thankful to all the partners who have organized this very successfully. And as Eileen was referring, that it was a major challenge to, since last 1.5 years, when all of us are confined to our homes, limited mobility, to not make, to not turn this program into yet another, online thing, because I could see I was part of some of the events, some of the programs, and it was very active. I was happy to see the enthusiasm from both the sides. Now, where we come from, why we are supporting this program is I represent GIZ, the German Development Corporation. Most of you know who we are, so I'll not talk much about the organization. Basically, a not-for-profit organization, a development organization, but primarily owned by Government of Germany. So we implement technical support program, which is agreed between both the governments, Government of India and Government of Germany. The importance of Indo-German collaboration, particularly in this startup arena. I remember 2 years back when there was meeting between head of states. Chancellor Merkel was here and with Indian Prime Minister Modi, and it was in the agreement, there was one very specific point that there is a need. Both the leaders reiterated that there is an importance for convergence in the startup ecosystem, and there's a few things were charted in that agreement also, that there is need to have a constant exchange between the startup ecosystem, and not only ideas, but also programs should be shared, joint programs, and all. So we see that this commitment, this importance comes right from the leadership level of both the countries. And when I look at India, because I've been working with SMEs and startups and incubators, and also because being a part of German company, I'm aware a little bit about what's happening in Germany. How I see is what is the importance is, from Indian point of view, we all know that we are a big market, one of the fastest growing economy among top 2-3. We have huge number of startups, over 600, 800 incubators and accelerator programs. We have youth, a lot of youth population who are engaged in startups. I was reading some report, I think average age of startup founder in India is somewhere around 25, 26. It used to be slightly higher, 28, 30 a couple of years back. We also see a lot of women entrepreneurs. So, this, and of course, India being a big market. So this is something which is exciting for many of our, might be exciting for our German partners also, many of the stakeholders also. And we as an Indian stakeholders, as an Indian startup, when we look at Germany, so our expectations are very clear. The moment Germany word comes, in Indian mind or in any mind throughout the world, it is about technology. It's about precision. It is about the partnership and stakeholders and how you build it in a systematic manner. And of course, the investment and market part of it. And I think keeping all this thing in mind, in this context and background in mind, as Eileen was sharing, this is the 4th startup tour we are being part of. And I'm very happy to share that the results of first 2 were very encouraging. It was very impactful. Maybe over a period of time, some speaker would share it also, but I understand that a couple of startups were able to find some investment opportunity and mentorship opportunity also from after the program from the corporates in Germany. And I look forward that in today's program, where there will be 2 sets of, 2 tours which were organized from the healthcare and tech startups. So this demo day, I wish you all the best, all the startups, and I really hope that this would be impactful for some of you, and you might find when you'll be pitching in front of the experts, potential and opportunities where you can take your innovations, your ideas, your business model to much, at a higher level. So once again, I wish on behalf of GIZ to every one of you, and especially last one word, that I am also impressed by the nature of stakeholders who are involved in this program. Because you see, of course, the German government is there, BMWI, BMZ through GIZ. You have GINSEP, part of Startup Association, which is everyone in Indian startup ecosystem know them very well. CEFE International has brought everyone together for this program and done this impactful training program. You have other organizations like NASCOM or, so all this stakeholders partner profile is also quite impressive. And I think together, this program, when it's coming to an end today, the tour part of it, I hope that it will be impactful for all the few startups. So wish you all the best. And that's all from my side. Back to you, Julian. And thanks.
Wonderful. Thank you very, very much, Shankar. And once again, to you, we are really, really grateful from GINSEP side to have you on board, have your support from the GIZ, not for the first time. It's really helpful to have these partners. Actually, it's crucial to have these partners with their resources and their expertise to also make these tours happen. After all, so that of course applies to you, the GIZ, but also to SAFE International, of course. And that is the idea. Just to mention that briefly again of GINSEP in the first place, that we ourselves at GINSEP cannot make these things happen alone. No, but we're always looking for partners. And as Eileen mentioned correctly, that more than 30 different partners were involved in making this startup tour happen and bringing these different players and actors together. And I think this is a really impactful way of doing this. But once again, great to have the support of the GIZ and SAFE International to make this happen. So thank you very, very much, Shankar, for this. I'm also one of a representative of another partner that is supporting GINSEP, or part of GINSEP also since 3 or 3.5 years, namely NASCOM. And we have our good friend Navatan Kataria also here in the call, who will be speaking a little bit about India's tech role globally. And Navatan is based out of Bangalore. He's the director for the innovation and entrepreneurship for IoT and AI at the Center of Excellence. He'll be giving a brief presentation. Now I see he's there already. Navatan, can you hear me?
Yes, I can. Can you hear me? I'm
Yes,
seeing
we
my
can hear you.
presentation.
Great to have you
Okay.
here. Over to you.
Oh, yeah. I'm fine. I'm in a very cold country, -15 in Finland right now. So bear with me if I'm staggering a little bit. But this is the center that I represent from India. I wanted to quickly run through where we are and why India has become so important. If you look at every kind of platform that is available for any startup globally, this is the place. Sheer population, sheer gives you the market, and of course the amount of infrastructure activities that we have is a very good sandbox for any startup globally to come and use and apply their solutions. Many of you are already aware, but we have 70 plus unicorns and 38 startups added in this year. It looks like Santa Claus is already here in October. We added 6, 5 in November. I don't know how many in December will come up. But the good thing is that many of your startups are now today in healthcare, and you see that the first health tech startup also became as a unicorn in this year. So this is a very good sign that it's not only traditional B2Cs, but a good advantage of being in India with a huge base to deploy your system gives you the opportunity to try not only technology, but the market potential as well. And this becomes important because when the sheer volume comes up, there's a whole game change happens. And that is why I would like to also say that some of these startups have actually moved away from India as well, not away, but also included a lot of other markets. If you look at OAs, the Olas and the Baijus of the country, they have gone into many countries. And this is just an example. The reason I am saying is that all the tech companies that are based in, say, the European parts, as well as in India, today, India becomes the hub for getting onto the global market. And not only market, I must say that the technology collaborations that happen between startup to corporates is phenomenal. Of course, we are engaged with the industry, the startup ecosystem, research and government ecosystem. But what we have also seen is a highest number. We have like 8 countries, and Germany happens to be on the top of the list, if I can say. The number of delegations, whether it's political, whether it's delegates from industries or SMEs, they are so, I mean, this is an old list, but if you look at the numbers that you see, we are very well connected to the German industry, and thanks to organizations like yours, it's a very good, elaborate cooperation that we are having. Technically, NASCOM comes to the fore because NASCOM, as memberships, has probably every IT company in the world as members. So you have the benefit of the startups, you have the benefit of the connections to the IT world, and of course, with COE, we also tie up with all the non-IT companies, which is the health tech companies, which are the IoT companies, which are the manufacturing companies, energy and agriculture. So this is a very good platform that allows any company to sort of take India as a stone to move on to the global market. And we all agree that unless you get into the global market, specifically in the non-tech areas or non-B2C, it is very important for you to have the global market as your potential. And each country, each startup from each country has a different flavor to it. We try to complement them all within themselves to give something what a corporate or a government or an NGO would require. So with that, I would close this very small session. Thank you.
Thank you so much, Navatan. And I think it's really, really important to understand the importance and also the momentum and the speed that all the startups and the activities and the growth that is there in India in the startup sphere. And I'm really, really happy that now you can also see that it's in the German. It's covered by the German business media as well. That of course. Having these unicorns, these success stories are always best to be covered in the media. But of course, there's much, much more happening. And I'm really, really happy that this is so. And I'm also, it's great to see, I'm really happy to see that there's so much happening also from the German side to India, that the attention is there and is focusing on India as well. Now and more is happening. And this is exactly what we want to do today with the demo day, to bring it on the agenda in Germany, to showcase great Indian startups that are not unicorns at this point, but maybe one or two of them will reach unicorn status at some point. So, and this is exactly what we want to do also today. So thank you very, very much, Navatan. And now I would like to welcome Jitendra Vijayvargiya from Mighty Startup Hub. He's the managing director and the CEO of the Mighty Startup Hub based out of Delhi. And Jinsep recently signed an MOU with Mighty Startup Hub to also foster our relations. The Mighty Startup Hub, they have many hubs in India. It's a great platform and network to with their centers of excellences to reach the regional startups there in different areas. And of course, for us, it's great to work with them to get access to these startups, but also in the other way for the German startups or German players to get access, maybe also in a soft landing way into India. So it's always in an inbound and outbound way. Jeet, can you hear me?
Yeah, Julian, thank you so much for the kind introduction. And it's a pleasure to be here today with all the participants. You know, when we look at this, we talked about India being a large startup ecosystem, fastest number of startups converting into unicorns today. But it's one startup at a time, right? It's about finding the jewel and then growing it. It's about giving a platform to startups so they have an opportunity to actually showcase their talent and realize their dreams. And a program like this, where we connect our Indian startups with their counterparts and markets in Germany and other places, gives us an opportunity to do what we can to enable the growth of our startups. Now, if you look at it, with great opportunity comes great responsibility. It's not only about creating unicorns that go on to make $1 billion, but it's about making huge impact around the world. So concepts of tech for good, or talking about healthcare. These are the sectors where we actually can realize our Honorable Prime Minister's dream of actually India making it for the world, where the Indians can collaborate under the common vision of shared values, democratic systems, and creating a large impact for people around the world. And I think some of the startups here today that are along with us may be one of them or two of them that can actually go on and make a huge difference. And hopefully all of them in their own lives and ways will make an impact for our ecosystem. Now, having said that, at Mighty, at Ministry of Electronics and IT, we take pride in the fact that to realize our Honorable Prime Minister's vision, we have been working tirelessly, just like other ministries, to provide support to startups through 51 incubators that we are supporting across India, to 26 different center of excellences focused on deep tech areas, various funding schemes all the way from idea level to growth stage funding. There's a lot of interventions that we are providing so that our startups and our entrepreneurs can have more ease of doing business and realizing their dreams. One of the key initiatives that we do is building these bridges across boundaries so our startups can actually engage more globally. And Julian's program is one of those hallmark programs which allows us to showcase these startups. Aside from this, we are engaged with our counterparts in France, in UK, in US, and multiple other countries in South America as well as in North America. And now we're looking at Middle East as well. So the goal is that, if you're a good startup and you have a solution that can be scaled up and supported, we would love to introduce you to the counterparts in other countries and vice versa for those our country partners. We want to bring more innovation to India. We want to create more competition for our startups. We want to create more collaboration opportunities for all the ecosystem players. So with that goal in our mind, we have been working on these initiatives. And without taking any more time, I would wish best of luck to all the startups here today that are part of the demo day. May God be with you. May you have all the success as you move forward. And may this platform provide you an opportunity to build new relationships, create new coordinates with people across the globe, and may you be able to launch your products in a way that can really make an impact for people. So thank you so much, Julian, for the opportunity, and look forward to hearing the pitches.
Thank you so much, Jitendra, for your insight. That was very well received. It is time actually to start the pitches. We will have 8 healthcare startups. Some of these startups are digital startups, but some of these startups also have hardware products. So we have gone beyond digital solutions this time to also give some of the hardware startups a chance to be part of the tour. And I would like to welcome Shalom Kingston from Carbon Hubs. So Carbon Hubs is actually solving the problem of microbial infection and air-related problems. But I think he can tell more about his solution than I can. So over to you, Shalom. Are you there, Shalom?
And that's what happens when you do a live demo day, live pitch, right? We don't want to pre-record all these pitches. So let's just. Yes. But I see the screen is coming,
and the presentation.
So the presentation is coming. Shalom, are you there?
Hello.
Yes, we can hear you now.
Yeah, perfect. So please let me know when I can start my pitch.
You have your 5 minutes starting now.
Okay, great. Good morning, my friends from Germany as well as from India. Good afternoon. So I represent a company called as Carbon Hubs. Carbon Hubs is specific to B2B, air purification and microbial detection company. We have 4 products in our hand, but we work with 2 products, which is a major hot cake for us. So our vision and mission, following the footsteps laid out to us in India to have a large-scale innovation in terms of product as well as software to create a product from India and to scale it up globally. That is our vision and mission in terms of technology as well. So what exactly are we solving? In specific to the problems that we are facing in the B2B sectors, every B2B sector is having impact or it's been facing the impact caused by the microbial infection, and COVID being one of the most recent or most impactful examples that the B2B sectors have actually realized. And in the B2B sector, generally for any microbes to be detected, it takes a span of 10 to 15 days. So when the B2B sectors are running in full scale, 10 to 15 days, it's enough to infect roughly about 200 to 300 employees in a very large scale. Using our product, we provide a retrofit or a standalone device where we are able to predict the microbe, not in 1 day or 2 days, but just 2 hours from getting infected or getting exposed to the contaminated zone. Our solutions are specific to the B2B sectors, which is ranging from 10,000 square feet to 30,000 square feet. We're able to reduce the pollutants in specific to 0.1 microns or 0.3 microns, and we're able to reduce even the gas levels, one of the most major USPs in our product that we have. So as I've told you, there's enough of cases in terms of the pollutions caused in the industries, in hard-hitting industries with the B2B sectors, where our product will be able to provide the solution in terms of reducing pollutant. So first thing, the second, detection of the microbe. Third, and the reduction of the gas levels. We provide a HVAC system, retrofit to the HVAC system or a standalone device. We also provide a software which can predict the microbes prior to the inspection outbreak, and goes up to almost around 10,000 square feet to 30,000 square feet with 99.97% accuracy. And the market that we're focusing globally is quite huge, and the number of players in this are quite less compared to the solution, the USP that we bring on board. We're able to predict it 99%, and the market that we are in is gradually growing, and it's going to be $220 million by 2022. And the number of the most interesting fact in this is the number of installation of HVACs. From 9%, it jumped to 60% due to the COVID impact, and a lot of people are focused on actually having a well-maintained air quality levels for their premises. And the market space that we are in, whether it's B2B or B2C, we have a lot of players in this particular sector who claim to do purification in terms of only dust and in terms of only particular matter, but they're not able to do it as we are able to do it in microbial levels and nanometers of ranges, which is a major impact that we are bringing on board. And we have larger players in the AC segments that are not able to fulfill the needs of the B2B segment, where we are able to fulfill the needs of the B2B segment at a very large scale. And these are the products that we are in. We're bringing in on board with a HVAC system or a standalone device, which can detect and purify all the microbes, irrespective of what has been exposed. Going up to our competitors that we are focused on, these are the competitors in terms of B2C as well as the B2B, where in terms of cost as well as in terms of the market that we're in, and the USP that we majorly bring on board to the B2B sectors is the microbial detection, on the services, and our ability to predict the microbial instead of waiting for 10-15 days. We're able to predict in just 2 hours, which is a major problem solver in case of the B2B segments. And one of the major USPs that we work with in the B2B segments, these are the factors that we bring on board to the B2B segments, and I would say the value point that we add to them, because we're able to reduce 40% of their air qualities in just span of 2 hours, and we're able to reduce 80% of the gas levels in the exposure of just 2 hours. So whether we sell the product or not, we're able to add the value to the particular B2B organizations. And this is some of the small achievements that an organization as a product, as a company that we have achieved. And this is a team that are currently working on, and I'm done with particular slide and open for questions right now.
Wonderful. Thanks so much, Shalom, for this. Before I'll ask the jury members to give them the floor to ask you some of the questions, I would like to introduce them first, starting here to my left. We have Klaus Kammermeier, who has supported us also in the past. Was part of the event in the past as well. He's the founder and CEO of the Innovations Lab here to my left. And then we have, starting at the right, Maren Lesche, also with the founder and program director of Vision Health Pioneers. She's also a GINSEP ambassador. So great to have you today with us as well, Maren. And we have Ferdinand Mühlhauser here as well, today managing director of the Founder Institute in Berlin. Great to have you there. And another familiar face, Eileen, who will be also asking some question and be part of the jury. But we calling it jury, but it's not a startup competition. So I want to mention that it's very important. It's more of giving the startups a chance to present themselves to the audience. So these questions won't be. They will be important and might be also mean questions, but it is more about to find out, are you the right startup? Are you ready? What are the pain points? Have you thought about everything? But it is not a competition, so we're not having a final winner at the end of the day. So I just wanted to mention that. But now over to you, Eileen, to moderate the question.
Yes, Are there any questions from our experts for Shalom already? Please go ahead, Ferdinand.
So, interesting product and certainly at the right time currently. What I would love to understand is the size.
Not audible.
Pardon?
Your mic is not audible.
1 second. It looks on, but dead battery, it says. Is that better? Hello?
Yeah.
Yeah?
We can hear you now.
Okay, perfect. So, product obviously in the right time, as there's a lot of purification, air purification necessary at this point of time. What I would love to understand better is you mentioned like the size of industries where it fits, like 10,000 to 30,000 square meters. What does restrict this? So, why do you not fit to larger or smaller buildings? And what would be your market entry strategy for Germany? What have you found out so far?
All right. In specific to the particular way that we are trying to do the purification is only on the B2B sectors, and generally in India, the market space that we're working is ranging between 10,000 to 30,000 square feet. When compared to the global players like Carbon Engineering, for them, for a particular fan or particular turbine takes around 4,000 square feet of an area. So 4,000 square feet of an area, when you consider it in India, it's quite huge in the B2B segment. So we are focused on only this particular bandwidth. The reason being because the ability of the product to increase, and because there's various factors when you place the product. One of the factors are cold air and the hot air due to the HVAC systems. And major of this players that are 10 to 30 feet, 10,000 to 30,000 square feet of an area that have the HVAC systems. So once these kind of HVAC systems are already placed, it makes it much easier for us to place the product with a retrofit instead of placing the entire HVAC for the organizations. So HVACs are usually placed in this particular sectors, and this is the reason we have taken this particular metrics on reaching the B2B organizations. That's your first question. Hope I've answered that right. And the second question, in terms of reaching out to German organizations, we are trying to do collaboration with the German organizations that we are working closely now. We just having initial discussion where we're trying to do some brand collaborations, and we're also starting to, instead of moving the product inside the market, we're trying to move the software or the SaaS model of the product inside, where we can have a lot of AQI levels detected, pre-infections, as well as have a microbial infection detections to be done. And already the HVAC systems there are quite stable, but the purification there is quite low compared to the other purification levels. So we are bringing in our abilities in terms of the HVAC detection to the existing HVAC systems over there. So that is the specific thing that we're working on there.
Thank you, Shalom. And we also have a question from the audience. There's a company called IVP Air. So they have a fairly high number of patents and have a similar product. Can you tell us a little bit how you are different from them?
Right. We do have a lot of players in the market who have the abilities to detect the particular AQI levels or the air quality levels. But one of the major USP that we hold is the pre-detection of the microbial infection, because most of the prediction comes post the infection. We are able to predict it instead of 10 to 15 days for them to identify the particular microbe. We are able to identify the particular microbe in the span of just 2 hours. And major players in the B2C segments, they can only purify up to 1,200 to 2,000 square feet in the B2C segment. They are highly unstable when they play in the B2B segment, because the square feet of area is pretty high, and the air quality levels known as AQI is pretty high there, because it goes up to 800 to 1,000 AQI, which they can sustainably can't do it. Whereas with our product, we can go up to 1,000 AQI, first thing. Second, we're able to predict the microbe 10 days prior to the infection, and we go up to a 0.1 microns of purification. In the existing market, we have 0.3 of micron purification. 0.1 is quite low in the global market as well, but we are able to provide the highest level of purification in terms of all the pollutants compared to the market.
Thank you so much, Shalom, for these insight. And I would suggest we move forward. And we have the next startup coming up, Future Wave Technologies. But Julian, maybe you can tell us a few words. What is the startup all about?
Yeah, the startups is building products that help you tracking your health. And this is Aldrin Alfonso, who has joined us now. Aldrin, can you hear us?
Oh, yes, I can hear you very clearly. Can you hear me?
Yes, we can hear you. So,
Okay, wonderful.
are you ready to present your
Oh,
startup?
absolutely.
Wonderful.
Yes, I'm very
Okay.
much.
So then the
Can I
floor
start?
the floor is yours for 5 minutes.
Okay, wonderful. I was hoping I was there physically as well. It looks a very beautiful setup. So before I start, a little story to share with how it all started. It was Easter Sunday of this year, and we were getting ready to have a good Easter lunch. I was not feeling pretty comfortable because the previous night I had a temperature, I had diarrhea, and I had the chills. And so I was told by my folks to go visit the doctor and check why is this happening. And then when I went to the hospital casualty to check my vitals, everything was okay, but I was advised to do a RT-PCR test. And after I did that, I was diagnosed with COVID-19 myself. The party didn't happen. More importantly, I also happened to infect my mother and my sister-in-law as well, who had to be hospitalized. So that brought me to the fact that I could have possibly, done something about it much earlier. Maybe isolated myself earlier if I had known that I was getting infected with COVID. Unfortunately, that was not the case to be. Now, let me just tell you as to what exactly happened. Now, to give you a little, analysis of what really happens with COVID, between minus day 14 to day 0 is the incubation period, and the transmission begins from day -7 onwards. And that is exactly where the transmission starts, and it kind of progresses. And then from day -7 to day 0, the symptoms start happening, and by day 7, the full-blown COVID is detected. So that is exactly where, had we had a solution like EVAC, which we will talk about, maybe before the transmission begins, we could have known that I was getting infected and possibly stopped the spread by isolating earlier. And so therefore, I would welcome you to EVACs. Will comment to everyone in Germany, good morning to you, and in India, namaste and good afternoon. So EVACs enables early detection of COVID-19 and cardiac diseases that leads to early treatment, isolation, and lesser health cost. So what the problem is that we're trying to address is there is no early warning about the disease onset. There is unplanned hospitalization because of late detection of the health condition. And of course, high hospitalization cost as you delay the treatment. And of course, you need to contact multiple agencies to deal with their treatment and of course, post-hospitalization. So what are the value proposition that we bring to the table? EVACs is a device and AI-led diagnostic system that enables early warning, action, and control of COVID-19. How we do this is we monitor the vital signs 24/7 because the user is wearing a wearable device. We do the data analysis of the data that we receive, and we have biomicro identification through our AI algorithm. We use the NHS-based scoring system, which is referred to as National Early Warning Scoring. The diagnosis is done on the basis of this scoring and the past data that we have. And then the doctors have a digital prescription that is issued. And of course, post-treatment, the vitals are still monitored because the customer is wearing the wearable device 24/7. So we are able to give the customer a better diagnosis and track the progress of the individual. So this is exactly what the device would monitor in terms of track rather. The fever, the blood pressure, the SpO2. Further, what is the business model that we've got? We've got, we're targeting a market of 310 million euros, and we will be using device sales, and also we have a subscription model as well. And we plan to have about 358 million revenues by 2025. We plan to go to the market using the B2B model and the D2C as well, and also the B2G model as well. Because when we did a research on the German markets, we had enough of opportunity to kind of use our solution out there. And this is how we plan to do it. Our main competition that we have in Germany, especially, are ADA, Clue, Allscripts, Aura, of course, and Residio Pro. we have positioned ourselves as the most economical in terms of the pricing. Right, so this is what we're looking for: an angel round of $1 million, £1 million, for 134 devices to be manufactured over 3 years, and we're looking at a revenue of 6.5 million over a period of 3 years' time. So this is the team that we've got, ranging from entrepreneurs, first-time entrepreneurs, to experienced personnel, and a medical doctor on board, as well as a biomedical engineer. So this is what we have in store for you. Yeah.
Unfortunately,
so we are ready.
Your 5 minutes are over, and we have to cut you short because you have to also learn to present it in 5 minutes to investors.
Sure.
Are there any last points you want to mention? Maybe otherwise, I would hand over to the jury to ask you questions.
I'm almost done. Almost done. So the last slide was just the
you're not giving up.
Yeah, I'm done. I'm done.
Very good. Can you hear me?
I can. Yes.
Perfect. I'm actually screening and scouting a lot of startups right now with similar solutions, because Vision Health Pioneers Incubator is also focusing on that. And there's always the question, if you introduce a new medical device, like how reliable is the hardware device you present? Because again, if you don't detect the right biomarkers, your software and AI solution is not working. And I think for many reasons, variables of this kind also have to be classified as medical devices, at least here in Europe. So I'd like to know how, first of all, what's the accuracy of your hardware device and how far it is? Because I also have seen that you won an IoT award, I think in 2019. So I think you actually worked on that project before COVID came up.
Absolutely right. And thank you so much for that. In regards to the accuracy, we have tested the device in a hospital setting, and we've got close to 95% of accuracy for temperature, for the heart rate, and for the blood pressure as well. Only for the ECG, we had about 70 to 75% of accuracy, and we've been working on getting that sorted out. But otherwise, we've got about close to 95% of accuracy. Because we are using clinical grade sensors as a part of the device.
Thank you. Is there any other question from the jury, or should we move forward? Yeah, Klaus has a question for you.
Maybe
Sure.
Could you just quickly clarify the market size? Was this Germany? Was this Europe?
Sure. The German market that we have in terms of the medical device market is about 39 billion euros. So that is the German market for medical devices, and that is the market that we are targeting. And Germany is the #1 player in the medical devices market.
Maybe I can ask, have you already started this CE certification and the medical device approval process here in Europe? Because, you're also competing with like Apple Watches and Garmin and the fitness trackers that added, certain biomarker services to the already existing quite established product portfolios.
Well, thank you for getting us in league with these companies. We have started the process here in India. However, we are yet to kind of start the CE process for the European market. We hope to do that in the first quarter of the calendar year 2022.
Thank you so much, Aldrin, for your inputs. And I would like now to open the floor to another very exciting startup, actually, who focuses on cancer treatment. Dinesh Koka is representing Onward Assist, and Onward Assist helps to improve cancer treatment outcomes by solving the problem of accurate and timely diagnosis based on cancer pathology and simplifying the process. I as a person, don't understand anything, but I'm sure that Dinesh can explain it much more in detail and much more clear. So Dinesh, over to you.
Yeah, hi Eileen, thank you. Are you able to see my deck?
Yes.
Thank you. Yes, thank you Eileen for the introduction, and hello everyone. My name is Dinesh, I'm from Onward Assist. We primarily focused on improving cancer treatment outcomes because as we all know, more than half of cancer patients receive treatments which don't work for them. And that's a problem that's not unique to where we are from, which is India, but globally. And when we understood the reason why we focus on pathology, like it was introduced, is pathology serves an important role in providing all the information that is required by an oncologist to take an accurate enough treatment decision. As a patient gets diagnosed, biopsies, cancer biopsies provide critical information about not just whether it is cancer or not, but also in terms of characterizing what type of cancer. But the problem there is there are not enough pathologists. The number of pathologists for a country like India, we have only 500 pathologists, and that is a critical piece of information we are missing out, and obviously that leads to delays or suboptimal outcomes. The reason we want to focus on this is, like I said, improve outcomes for all cancer patients. And the reason we chose pathology, like I said, one is the importance of the information, but also the lack of enough expertise around it, but also because cancer pathology is an evolving space. There are newer markers being discovered which can help in better treatment, cancer treatments. It's Onward is led by a team which understands healthcare as well as has built businesses around technology, deep learning, as well as in pathology lab operations. And what we have been able to achieve, we've been around for close to about 4 years. We prioritized clinical collaborations, working with leading cancer institutes, building those collaborations, and all the solutions or AI tools that we build are purely out of these collaborations. So what is it that we do? Coming to the point, we primarily are mapped to the cancer treatment workflow. And what we build is a pathology reporting workflow, a user-friendly reporting workflow, which helps cancer pathologists manage their reporting process. And two, on top of the reporting workflow, we also provide AI tools or machine learning-based algorithms which help in evaluating the images of cancer biopsies and helps them report it faster and with higher accuracy. That's primarily what we do. And within the pathology AI tools, we focus not just on primary biopsies, but we also have tools which analyze what is called advanced biomarkers, which helps in further characterizing the patient into different fields. So that's the solution. We call it a full stack solution, combining a user-friendly software with an advanced analytical tool layer. Our primary focus is breast cancer and prostate, out of which we have 4 biomarkers undergoing clinical trials. And the reason we are confident about this is all of these tools have been built purely through clinical collaborations, like I mentioned earlier. This is just a very small example of a couple of the AI algorithms that we have built. What these two help is in evaluating the image of a cancer biopsy or different types of biomarkers and doing the automated quantification. Because today, the pathologist might be doing a lot of eyeballing, or there is, which leads to a lot of fatigue and, in the most extreme cases, inaccurate reporting of biomarkers. Our goal is to take out the inaccuracies and make it faster and more accurate. And where we are, we've achieved traction in terms of the customers who are using our both software workflow and leading cancer institutes across India, US, and UK who work with us in our AI collaborations. We also are prioritizing tie-ups with corporate partnerships. For example, our AI layer or AI platform is now available on the Edison, the cloud of GE Healthcare, as well as we are as part of a collaboration with PerkinElmer in collaboration for our telepathology software. And our current focus is primarily around accelerating our go-to-market efforts in commercialization, acquire more customers, and complete our clinical trials for the AI tools, because once we complete the clinical trials, we'll be able to commercialize the AI as well. And we've been grateful enough to receive recognitions and awards, which kind of help us also enable our work as well. Our focus in Germany is primarily to work with potential partners who understand the space, but primarily around helping us get opportunities in digital pathology, as well as replicate the validation trials that we're doing in India to be able to do it in Germany as well. Thank you. I hope that gives a good idea about our work.
Thank you very much, Dinesh. To the jury, any questions? Ferdinand.
I actually had a case in my family of cancer, so I'm quite touched by the things you explained. What when watching this from the outside, so the process from the outside struck me most was that the different treatment doctors treating with different cancer treatments would not really talk to each other a lot. So it was not very. It didn't feel like there was a holistic view of the cancer and the type of cancer, as you mentioned, and the right decisions taken in the process. How do you support that then? And what is exactly the input that you need and the output that you give to make this decision? How the cancer is to be treated?
Sure, thank you for the question. So our focus today, our biggest focus area is cancer pathology. So within the pathology AI work, the input is the image of the cancer biopsy slide, and the output is the image of the slide which has been analyzed with some segmentation and the pathology report, which is what the pathologist would give. But today they rely on looking at the biopsy slide through a microscope. Instead, the input is the image, the high resolution image of the cancer biopsy slide. The output is a automated pathology report, cancer biopsy report. Is that helpful?
To some extent, understanding your solution, how that automatically helps to define and maybe even to improve the process onwards. That would be interesting. How it fits into the German cancer treatment system.
Sure. Thank you for the feedback.
Dinesh, Klaus has another question. Over to you, Klaus.
I do have.
Okay.
So, as I understood, you basically are not a patient-facing solution. You support the labs, right? So,
yes.
Your business goal is to get in touch with the labs, provide the software. So, the hardware devices that they have that generate the images is the first step. And by the way, this is one of the bottlenecks we have, because we don't getting the images is actually the time-consuming part. But then you basically optimize the process once the image is there and in the lab. Is that correct?
That is right, yes. So the device that is required is digital pathology or a slide scanner. So the adoption of digital pathology is still happening. The transition is still happening. And we see that adoption of digital pathology in diagnostics, as in hospitals, as well as in pharma as well, where cancer pathology reporting happens. So to your point, yes, where that device is or digitization of slides already happen is where we provide the solution and enable that workflow.
I'm very happy to connect you to two companies also in a similar stage. One is Lab Forward. They actually help labs to optimize their processes, but I think they're not focusing on the solution you have. And there's actually a young startup called Omlot that is also working right now in shortening the time to actually get the information from the patient. So they will reduce the time it takes to take a picture from 20 hours to 2 hours. And again, then that information would be faster in your system, and then your system or the software that you provide would support it. And I think it would be able to actually do more biopsies, have more information, actually get the information that you said quicker to the doctors and then to the patients. I think that would be a nice value chain to create.
Great, absolutely, Martin. Would love to get in touch, and then we'll take the details of the startups as well. Sure.
Wonderful. That's what the event is for. Thank you so much also for that, Maren. One quick question from Klaus.
Yes.
Impressive track record you have there. Could you tell us a little bit more about your team?
Sure. Sure, Klaus. I'm actually sharing my slide, but I'm not sure if you're able to see. So I've worked in the healthcare space about 19 years now. I used to be in the corporate side with G Healthcare, ran healthcare IT business for South Asia, worked in public and private healthcare space. My co-founder and my partner is our CTO, Vikas. He has a PhD in signal processing and worked in that space for about 17 years now, including a stint with Roche, where he did work with digital pathology. Our chief medical officer is Dr. Lata, Dr. Kinney. She brings 3 decades of experience having led pathology labs. And Dr. Rohit is our product strategist. Again, trained as a doctor, has done his MPH from the West in the US, worked in the US for about 7 years in the oncology space as well. and runs the product marketing. So our entire team size is about 70. A big chunk of that is in the technology side, but driven by a team which is very passionate about leveraging technology for meaningful solutions in healthcare.
Thank you so much, Dinesh, for that. Really impressive. Let's move to the next startup, which is called Purple. And Sahir Kungancheri, I hope you can hear me and that you are there. What does Purple do? It's an intelligent solution to connect patients, doctors, caregivers, and hospitals for remote healthcare. Sahir, can you hear me?
Yes, of course.
Okay, wonderful. So the stage is yours. 5 minutes.
Sure. Let me share my screen. I hope you guys are able to see my screen. And
yes.
Good morning to my German friends and good afternoon for Indian friends. Myself, Shahir, the founder of the Felixa Care. Felixa Care is a software platform for the digital health and which connects the patients and the hospital, especially healthcare entities and just a second. Healthcare entities and the caregivers and the devices for the continuum care. So I would love to start with a few happy news that we are funded by Malta Enterprise for beginning the office in Europe. We'll be starting our office in 2022, first quarter itself. And we got an seed fund offer from the government of India for healthcare, AI and research. The problem what we are addressing is when the pandemic started hitting in the world, we found lots of patients, especially chronically diseased patients, including my father, facing problem of attending the hospitals and receiving the care. So this started thinking about something to start from this segment to get the continuum care to the chronically diseased patients. And I started the researching of this topic, and I found there are huge amount of people in the world actually facing the problems due to the COVID, especially, and this problem is going to be increased, or it's there already in the market as well. Basically, the people who are out of the hospital after the treatment, actually they're out of this the care. That's what we observed. Is most of the trauma happens because they're out of the care. So this is the problem we are trying to solve. Then my research included the elder populations in the world, because elder population in the developed countries and developing countries, they are maybe they're at home or during the pandemic time, they are not able to go to the hospitals and they were not getting the proper care, and the government is spending a lot for that. So I was trying to reduce the expense of the elder care and giving the most possible impact to their care. This is what my plan was. And my research again continued about the segment. I found that the number of beds for the 1,000 patients in the world itself is very less. And of course, it's tested, specified in the COVID time. And then around fifth, then I tried to find about the insurance companies. They are giving the confidence to the patients. And from the experience from the customers, insurance companies, they think these insurance companies could have give better service. So around 58% of the people thinking that these insurance companies can give better service, and around 84% of the insurance think that the technology can improve the business. That's what the statistics says, and especially in the German market, it's a big market, and still the digitization is getting into the it's in the verge, it's in the in the beginning stage, I would say. In the statistics says that around 15% of the German doctors accepts online booking. So it's growing. It started growing actually. There are 85% is remaining, and 70% of the German people wanted a digital system in the healthcare. So I got this from McKinsey report. I have the data with me. 70% of the people wanted the digital system in the healthcare. 75% believe that digital health devices health. It's a Deloitte report. It's a worldwide report. 75% of digital health, personal device users believe that this can change their life. So this is the market actually. There are hospital visits declining, 60 to 70% of declining is observed from the expectation. In the outpatient care market is increasing. $3,784 billion is the market size of the outpatient. Yeah. Yes.
Sorry to interrupt you. You're almost over with your time. Would you like to come to the solution? I think this is more interesting for the audience.
Yes. Yeah, I'm connecting the patients, they're at home, and the hospitals and insurance companies here. So this is the pictorial representation of that. I have the software ready for using. I have the customers already having. I recently, January, started the application. By this time, this much of customers I've got acquired. Even Middle East, I have the customers. In the maternity hospital in Malta, I already had started discussion with that. That's what I starting off with the government funding of the Malta. And my roadmap, this one, I have a scaling plan in the Europe. I have a development plan for the B2C market as well. I have to integrate with other devices. I'm planning to raise, 3 million euros for the 10% of the stake. That's what my plan is. And here, my contact details are here. I've been working with IBM, Siemens, HP before starting this startup. I have a team member of 12 and another 2 more co-founders. Thank you.
Thank you so much, Sayan. I think Maren has a question for you.
I do. I hope my microphone is on. Have you dived deeper into the German healthcare market? Because the countries you mentioned for traction are self-payer markets, and you also mentioned that the health insurance companies are part of the platform approach that you have. In Germany, more than 70 million people are part of stationary care health insurance companies, and they are quite tricky. I think this is one of the biggest hurdles for international companies to enter the market, to truly understand that. Can you elaborate a little bit more on that, like how you understand the German market?
Yeah, of course. Maybe the TK, your biggest insurance companies, they have an app. So I spoke with a few youngsters in in Germany. They are, they like the TK app, and the market wanted the digital solution, especially from the healthcare perspective. And the insurance companies, there are 540 insurance companies running in the Germany. So these insurance companies itself wanted to change to the artificial intelligence based technologies to give the better services. So this is my market in the Germany.
I also have questions from the audience. How many insurance companies have you spoken to? Because usually insurance companies do look for the lowest cost or the lowest cost solution.
Yes. This is the point. I didn't start speaking with any insurance companies in Germany, but in India, I have connections. But I'm trying to reduce the cost of the insurance companies by giving the better health to their customers. See, if we can defer the illness, so this will give huge revenue, huge profit to the insurance companies. So by using the health assistant apps, they can defer the illness, or they can keep their customers more healthy. That is the point that I'm going to give to the insurance companies using my app.
And another person from the audience is asking, why 3 million? And do you have a POC? And also, if yes, his name is Nandal Kumal. You could get in touch to show him also a demo.
Of course. I already have paying customers.
Okay, so your product is completely ready and you're selling it in the market.
Yeah, not completely. It's an ongoing process, but I have customers. My customer list is here. So these are recent customers, paying customers, and already created the leads internationally and nationally as well. So discussions has been started. It's going on.
Okay. Thank you so much, Sahir, for this pitch. And I would like to move on to the next startup, which is called Nuverse Health Solution. And Mukesh Matre is the founder and managing director. And what is Nuverse doing is they're placing intuitive preventive healthcare in the hand of global citizens. And what they mean with this, I think Mukesh can explain much more better than me. So please, over to you, Mukesh.
Yes, thank you, Eileen. I would like to share my screen.
Yes, you are.
Thank you. My name is Mukesh Matre, and I'm the founder and CEO of Nuverse Health Solutions Private Limited. Basically, Nuverse has been founded for easier delivery of healthcare services to the masses. So here I'm going to present our solution called NewEye, which monitors the intelligent health vitals, health vitals intelligently. So what we do currently is we use various medical devices like the oximeters, the blood pressure cuff, respiration rate devices, heart rate devices for heart rate variability, and wearables to measure our various health vitals. So the problems with these devices is that there is a cost involved, there is maintenance involved, shipping is required, regular charging is required for these devices. There are limitations to the usage. Also, help from another person may be required to use all these devices, and continuous upgradation may be required. And of course, there is a growing need of health data currently from the healthcare industry, the telemedicine, also from remote patient monitoring, and from nursing homes. Then public health organizations like the epidemic that we have seen recently. Pharmaceutical industries need continuous data for various clinical trials, marketing, and various other services. Insurance companies need a solution for onboarding, for ongoing risk estimations, and for health assessments. Of course, corporates are also worried about the wellness of their employees, so they are looking at a solution which can be easily integrated. And of course, the business continuity, where industries like hospitality and travel has been tremendously affected after this COVID. So our solution is a software-based solution for the mobile device itself. So one just has to look into the mobile camera, and his various health vitals are calculated. Right now, heart rate, oxygen saturation, respiration rate, stress levels, and blood pressure and heart rate variability are calculated over here. So the technology that we use over here is similar to the one that is used in the wearables, which is the photoplethysmography technology. And only difference is that we use remote photoplethysmography, where the camera analyzes along with our AI and signal processing the light reflected from the blood flow in the cheek region of the person. So basically, we are also providing two ways of measuring health vitals over here. One is with the face using the front camera, and the second one is using the finger, which can be placed on the back camera in case there is low light or the patient is totally bedridden. And this solution supports all age, skin color, and gender. We do not capture any facial or identification details from the person. This is the benefits of this solution is that it is easy to use, affordable. It can also be used in low resource settings since it can function without internet connectivity, and continuous power supply may not be required. It works on mobiles, laptops, and desktops. And yes. So currently, as I said, we are measuring blood pressure, oxygen saturation, heart rate, respiration rate, heart rate variability, and stress levels. We are also providing raw data for HRV. And in the future, coming few quarters, we'll be launching hemoglobin, then blood alcohol levels, followed by temperature and blood glucose. So we have not yet launched. We will be launching in the month of January for the ASEAN market via the retail, for the retail consumers via App Store and Google Play Store. And we are targeting a download of around 50,000 users per annum, charged at $50 per user. We are also looking at corporate collaborations. We are currently in talks with two big insurance companies who are interested in our solution for their onboarding platform. So this is the estimated revenue that we have estimated. So basically, we would like to play a role in every across the telehealth ecosystem, whether it may be pharmacy, it may be insurance, it can be remote patient monitoring, and providing data to the government also.
Mukesh,
So this is a core
Mukesh, I would have to interrupt. I have to stop you here. Your time is up. Thank you very much for that presentation. Over to the jury. Any question?
Yeah, hello Mukesh. Thanks for pitching. This sounds quite magic, actually. That you can measure all those things with the app. So one important question I have is what the accuracy of this is, because it seems like it's very hard to determine all those measure these quantities from just the image. And the second question would be around the GDPR. So how do you go around data topics, personal data topics, privacy? And third, you mentioned how many users you will have. It wasn't clear whether it's already live and you already have traction, or whether it's just planned traction.
Yes. So let me start with the last question. We have not yet launched. We will be launching in the Indian market and the surrounding Asian countries in the month of January. And we are looking at around 50,000 downloads, initially. And also we are looking at collaborations with various insurance companies and corporates. So basically we will operate as a B2C and a B2B company also. Coming to your question of accuracy, we continuously do monitor our accuracy across various devices, whether it can be blood pressure cuffs, various pulse oximeters across various brands. And we have been fortunate enough to find it, medically accurate. Medical grade accuracy we have always found in the devices. Sorry, can you come again with the first question?
The other one was
sorry,
GDPR
about the data.
was the other one.
Yes, yes. So basically what, since the device, the measurements are done on the device itself, we do not need any data from the end users. So this is, as far as data is concerned, this is fully secured, and no data, we do not need any data from the end user. But the corporations with whom we collaborate, probably an insurance company, so they can have an understanding with their end user, and accordingly data can be transferred to them directly. Yes, sir. Thank you for that question.
Okay, thank you. The only thing that I didn't fully get is the accuracy. You were a bit lower in your voice, and is it medical grade, or what is the the comparison measures there?
Yeah. So we continuously monitor our various health vitals in comparison with multiple multiple devices in the market, which are FDA approved. And we have found that, it is almost 95% accurate. And the accuracy it goes on improving as we move forward with more installation. And of course, we would also go in for US FDA and other regulations later on. We are in the preparation mode for that.
Okay, wonderful. I think unless there...
I have always questions, but go ahead, because I'm most likely also reaching out to you. You should definitely also consider voice. I think the power of voice is something that will provide a lot of biomarkers that could enrich the solution you're working on. But on the other hand, you have to go step by step, and working with picture recognition first, I think, is a big step, gathering data, and then moving on. But I think there's a growth potential as well to get more biomarkers based on kind of different body functions, and I think it's very exciting. There are a lot of challenges in your solution as well, so don't get too excited. But you're on the right path, I think.
Great.
Thank you very much.
Thank you, Maren. Also, so great, Mukesh. And Maren, maybe you can also take it up later on. Wonderful. Okay, looking at the time, I think we should move on. The last 3 pitches of the healthcare startup session. So now I'd like to invite Uma Janapredi to join us. I hope, Uma, you can hear us. She's the founder of Symmetric. And what is Symmetric? It's an integrated cloud-based solution for digital transformation in clinical research. Uma, are you with us?
Yes. Can you hear me?
Wonderful. Yes, we can hear you.
Me?
We can hear you. Yeah.
That's great.
Okay.
That's
are you
great.
ready to start?
I am ready. Yes, I'm sharing the screen right away.
Wonderful. So the
Let me
stage
know
is
if
yours.
you can see it. Yeah. Can you see the screen?
Not yet, but I think it's loading.
Yeah, it's a little slow.
We can't see it.
Can you now?
Now it has come.
Yeah, it's taking some time to stream in, I guess. Shall we start?
Sure, please start.
Yeah, great. So my time starts now.
Yes.
Yeah. Good morning and good afternoon to everybody, who's there in Germany, and the folks joining in from different parts of the country, especially in India. And it's a great pleasure to present the Symmetric solution. But I would like to start off with the complete picture. We have started a few years back as a bootstrapped industry outsider startup in India to self-sustained, trusted, mature business with a global reach and 95% customer retention in the past many years. And our future goal is to become a partner in the journey of life sciences industry's digital transformation. And we have been experiencing this in the past few years, especially during the COVID times. And what we do, we have developed an integrated solution for clinical research, what we call the Symmetrics Clinical Trial Platform. And this platform is a modularized, flexible, and affordable solution that fits the requirements not only for the big pharmaceutical companies, but we are also trying to address the requirements and needs of small and medium CROs and pharma companies across the globe. And nowadays, we see a lot of biotech companies coming with new molecules, exclusive molecules. And this particular solution, what we developed, should be able to address the requirements, niche areas, very complex or simplified studies. And it got a whole gamut of different kinds of clinical research trials which are happening globally. And we are strategic partners with SAP in life sciences and have been a part of the SAP's industry consortium for life sciences, where we interact with the top 10 global pharma companies and trying to understand their requirements and bring in these innovations, what they need, especially in the critical times of COVID. And we are also strategic partners with 10th Pin in life sciences. 10th Pin is a management consulting company who are typically system integrators and who would be our future integration partners or implementation partners. This is about me, founder of the company. I was very happy to run this company for past many years successfully. And I hail from Hyderabad. I have interest in agriculture, and I was an investor in a CRO business before we started the business. I'm also a trainer and coach in spirituality, member of United Nations Equals, and I was also a part of an NGO previously before I started this business. And this is the solution what we developed or what we visualized to develop when we founded this. And it's an ERP-like solution, managing all types of clinical trials, trial analytics, which is already available on SAP's clinical trial platform, or BTP, what we call, when we have mature IRT, CTM, EDS systems, and we have medical coding and pharmacovigilance is to be built in the nearest future. And the product pipeline is in e-diaries, eTMF analytics, which is the most important aspect, which is bringing in the innovation into the clinical research, and technology adoption has gone more in terms of pharmaceutical companies right now. And then our story, innovation, we started with version 2 in innovation in 2014. Now we have come to reach a complete integrated platform which allows a seamless data flow from all different modules. And previously, the more important aspect what we try to cover is, in spite of pharmaceutical companies handling different stakeholders, different systems, we provide all the systems in one platform, and that makes the work of a pharma very easy. And we have been growing year on year, 100% profitable. I mean, not in terms of percentage, but we have been profitable year on year over the past many years. And our customer base has increased from 2 customers to 20 customers in the past many years. Investment strategy has been, we have been bootstrapped and self-sustained. So we did not have any loans or any kind of an investments coming in. But now we thought it's time that we have some partners, global partners, who can help us reach out to the global industry and serve them with better solutions. And this is the innovation deck, what we have, all different 18 modules built into a single database. And this database can handle, as I said, different kinds of trials. And in the pipeline, we have a pharmacovigilance, eTMF, and other models. And this is built on an Azure, hosted on an Azure platform and built on a .NET technology. These are the customers we have acquired so far. Teva is one of the first movers, and Glenmark, Nevagen, all of them global. And we have a pipeline of a few customers coming in this year. And in future, we want to reach out to more number of customers. We're talking about 30, 40 customer acquisitions the next 1 year. And this is one of the customer case studies. Maybe if you have time, I can look up to the slide. And as I said initially, that what is the customer ask? The customer is looking for one single platform to manage all kinds of clinical trials, from manufacturing to submissions. And together, a combined strategy of SAP, 10th Pin, and Symmetric, we are able to achieve this. We are not able to talk about these 3 companies, but we are also looking at integrations with medical devices. This is the future, what we are looking at, and this is the market strategy, opportunity. Yes, I'm done.
Perfect. Thank you. I think we all have to shorten the presentations a little bit, lesser text.
Yes,
would
yes,
be good.
yeah.
But thank you so much for the pitch. I
understood.
People interested also will get your pitches afterwards. So don't worry. But
Yes.
Are there any questions from the jury?
I do have a question, and thanks for the presentation. And I think what I truly appreciate that you validated your product, you have a lot of successful customers already, and now you think about growing and moving beyond the borders. One question from my side, or just like a question related to the growing or the changing industry. Clinical trials change these days. They need to be faster, they need to be more efficient. Also, if you see something like DIGA, the way evidence is gathered definitely changes. And of course, also for pharmaceutical companies, an approach like digital twins and having digital simulations plays a much more important role before they actually move in the traditional clinical trials. How is the industry changing from your point of view?
It is rapidly changing, and I think one of the most current requirement is the decentralized trials. We have been talking about it. I think COVID has helped us to change shift the gear of the FDA's requirements or the regulatory requirements. So there is a huge change, and this is the right time for us to be in the market to help the industry move towards more of innovations. We are talking about virtual trials. We are talking about handheld devices. We are taking care of the safety and security, data security requirements, and this is the right time to be in this market.
Klaus also has a question.
Thank you, Eileen.
Yeah, sure.
Uma, you mentioned that your customers are looking for a single solution. Can you tell us a little bit about the issues that you're facing with transitioning these customers?
It is, I don't think they're called issues, Klaus, but what I would like to say is they're already using a certain system, and what could be a need for these customers to move on from these traditional systems to more of an innovated or more of a technology-driven systems is the migration process. So we are also able to take care of the migration requirements, make the process more automated, more simpler, so that moving on from the traditional system to the integrated system is one way of looking at it. The other way of looking at it is we don't have to move all the current systems to a new system. We can develop the integrations wherein the data flows from multiple systems where the customer is already comfortable working on, then bring on the layer of technology onto the current systems with integrations with APIs so that the data is completely seamlessly flowing into different systems, and we have an analytics at the end of it.
Thank you.
I hope I answered. Yeah.
Thank you so much, Uma. And as we are already a little bit delayed, I would like to move forward to the next startup, which actually is a hardware startup working on hand prosthesis. And this is a huge market. I'm really happy that I have Prachi Karp with me today. She is a co-founder and COO of Life and Limb. So over to you, Prachi.
Yeah. Let me know if you can see my screen.
I can see.
Okay. Guten Morgen. We are Life and Limb. Our motto is touching lives one at a time. As you can see, we are developing an upper limb prosthetic solution with adaptive grasp. It is water resistant and a smart design. I am Prachi and I have Nishant along with me. We are a 6 team members team, and we are very new. We got incubated in August 2020 only, so we are a very fresh startup. Why and other processes. So we did a market analysis in India, and we found out that out of 15,000 inquiries that upper limb amputees put in, only 4,500 people actually get the prosthetic hand, and rest 10,500 don't end up getting it. When we did the further analysis of the requirement, we found out that they don't get it because the available solutions are sweat prone, they are heavyweight, they have no finger movement, and they are not washable. So because of that, we found this market opportunity, and we decided to dive in based on these requirements. So we have 2 products in line, basic and premium model. Our basic model offers water resistance, sweat resistance, user customization, longer battery life, and lighter weight. Whereas our premium model offers a different color and shape options, noise-free electronics, BCI EEG enabled interface, and app-based health monitoring and request platform. This is how our journey looks like. We don't want our product to be awesome, just our product to be awesome. We want their journey to be rememberable as well. So in conventional process, usually customer get their mold through POP, which takes around 7 to 8 hours. And often when they get the socket at the end, it is not fitting. So in our process, what we have done is we are basically taking a 3D scan of their residual limb, which is then converted into a 3D model, and finally printed and given to the user. This whole process takes only 1 hour total from patient's perspective. This is our first lab tested prototype, as can be seen. We have developed some more modalities in the prosthetic hand. We have compliant joint, which are flexible and strong. We have Lego-based structure, which allows us to remove the palm and charge it. We have hollow arm, which allows us to use a customization. We also have wiffle tree mechanism, which allows us to have only 1 actuator and therefore lesser electronics and longer battery life. We are already ahead of the competition in terms of functionality. We have lower weight, we have compatible joints, water resistance, and we are able to achieve 6 grip patterns along that can perform 15% of activity of daily living. We are ML and AI powered. We can perform health monitoring and haptic response, and also our product has thumb size independence. Even in the
Prachi, are you still with us?
I'll take. I guess
Our
she has
business model is very
problem.
simple. We are a B2B company, and our target customers are rehabilitation centers and piano clinics. Yeah. Our revenue will be generated through sale of base and premium model and the warranty and service of the hand. We are supported by Department of Science and Technology and MIT for our electronics part and ASME for our design part. We are also supported by a private motors company called Potiscap for our pilot unit testing. We have collaborated with Autodesk Foundation for free availability of CAD software for designing and Kivani Slim Center of New Delhi for our first 55 pilot unit testing. Along with that, we have won few awards as well. We have won Falling Walls Lab India, Magic Atmanirbhar India Award. We are also partnered with Mighty Startup Hub, and currently we are a part of MGIS also, wherein we are planning to incubate our company in Germany in next Q2 2022. Thank you. Let's make it happen.
Thank you very much, Prachi. That is really, really impressive. Yeah, over to the jury. Are there any questions? Ferdinand.
I think this looks really exciting. It also looks quite beautiful. I mean, if you look back at what prosthetics looked like quite some time ago, quite cool. What I would love to know is how it fits into the kind of the unit costs landscape of the different competitors you mentioned, and also into the 3D printing. I mean, we've heard that there's quite a lot of 3D printed prosthetics out there that people can just print at their homes. So how does this compare? I'm not from the field, so I would love to understand better.
Okay, so from market perspective, we are 1/5 time cheaper than the market. Current solutions are around, our solution is 4,000 euros, and from 3D perspective, 3D printing perspective, so we are using this technology because it gives us an advantage of user customization. So most of the times people want to use hand because they want to perform activities of daily living, and B, they want to look inclusive in the society. So with 3D printing, we are having the opportunity to match the anatomy of other hand as well. So that is why we are going ahead with 3D printing, and we have a lot of manufacturers already existing in the market. So we are planning to collaborate with them and get the hand printed through them.
Thank you so much, Prachi. And also, please have a look at the Slido chat on our website for the startup founders. There are a lot of questions also for you, which you could directly answer there as well, since we cannot take up all the information. But handing over to Julian to present our last startup.
Yeah, absolutely. We have the final startup now of the healthcare startups pitches, which is Cogniable. Manu Kohli, are you with us?
Yes, hi, good afternoon. I am here. My name is Manu Kohli, from Cogniable.
Hi, Manu. Good to hear you and good to see you. So I have one line about what you do. Cogniable is a machine learning driven assistive technology for early detection and affordable treatment of autism spectrum disorder. So that is the field. That is, you're providing a solution in that. So I'm really looking forward to hear and understand more of what you do and what your plan to internationalize to Germany is and what you're looking for. Are you ready to get started?
Absolutely, I'm ready to start.
Wonderful. So 5 minutes start now, and over to you.
Thank you so much. So my name is Manu Kohli, and I'm CEO of Cogniable. Why autism? So there are two reasons. If you see this graph, you would see how the autism has grown like in 1995 to 1 in 54, almost 2%. Every country's Academy of Pediatrics says that children should be screened for neurodevelopmental delay, especially between 18 and 24 months. But a lot of times, that are missed. And early detection is the key to start the intervention and treatments, which are behavioral in nature. So most of the time when the diagnosis is missed, the intervention is delayed. and even the certified people in the area of behavioral interventions are very less. In country like Germany, it is covered by the insurance and sometimes the public healthcare. But yes, there is a serious demand of a supply of good clinicians versus a demand which is growing exponentially to take care of that. So that is why the solution was, we decided to develop that. The second reason is we had our own experience with our child getting diagnosed late in autism, and personally, I stayed in Düsseldorf that time when we struggled for the diagnostic services around Düsseldorf, and I think it's the same everywhere, even in India. So that was another motivation for us to start that. So the team consists of people from medical. Dr. Chen comes as a pediatric neurologist, and I come with machine learning background, and then there is an international team with Dr. Josh from United States, etc. So let's look at the solution. So our solution is of two parts. So the first part is you interact with a child, you record its video, you put it on a cloud platform where the machine learning models analyze those. And the second thing is, based on those assessments, you build a personalized intervention and treatment plan that, based on the treatment data and interventional data, gets personalized over a period of time. And both these solutions have been clinically validated. So if you look in this video, you would see that a child is interacting with a caregiver, and his video is analyzed by the machine learning models on the behavioral landmarks that are very key in early assessment, detection, and even treatment planning and monitoring of the child's program. So this has been developed and tested with 1,250 subjects with the 7 large clinical hospitals in India. And we can detect a child very early based on simple questionnaire data, which takes 8 minutes to administer with accuracy of 98%, video-based assessment on an accuracy of 90%, and then personalized intervention plan, which comes with content, videos, and personalization recommendations to clinicians on what skills that should be taught with the content and videos, again, with the precision of 85%. So these are our clinical trials results. 8 minutes to administer, 95% accuracy on questionnaires, video-based assessments, almost 90% on behavioral markers. The treatment intervention has shown reduction in autism severity by 11 points, and personalization capabilities of machine learning model by 87%. If you look at the competitive landscape, we are at par with the other 3 solutions of Cognoa, Gemini, and Centerleach, or even better than that, because of our unit cost, development cost, and the spread of the area in both intervention and detection, and in terms of the clinical trials outcome as well. So the go-to-market strategy is very simple. You start up with the screening platform. You detect a child early, to pass a video of a child to generate a digital prescription, put him on the SaaS platform on the cloud, and the treatment personalization keeps happening with any kind of curriculum and any kind of behavioral intervention. The use case of these softwares are, the insurance cost. There is a 10% quicker intake if you start using our platform. A quality improvement is around 15% because the plan gets personalized and saves a treatment preparation time of around 20%. Video analytics gives you a significant efficiency improvement to handle, to get the outcomes of the assessments very quickly. And then, countries like India, where there is a very serious skill shortage, you can overcome that with the technology at a very quicker pace. So if we talk about our solutions, there is, a totally tech solution, and there is a service-based enabled tech, assisted services solution, which has grown quickly at a rate of like $30,000 to $40,000 per month, revenue right now in India itself, with present in 10 locations. And we are looking to launch our solution on a pricing, of very competitive pricing in the United States in the month of December as well. So this is, the cash flow projections, 6 cities in Q4 2021, where we are right now, with a revenue of per quarter $90,000, and expect to reach around $5 million within a year and a half. And in the US market, in the first year itself, reaching to $1 million, because it's going to be very scalable, because the services that we are offering are not available with the partners in terms of video analytics, machine learning, personalization, and cost and affordability as well. So, our current stage is
Manu,
the clinical trial.
I have to stop you here. The time is up, unfortunately.
Yeah.
But
Okay.
maybe one of the German members will also ask you a question regarding the next slides that you wanted to present.
Klaus, do you want to go first? I have questions related to the solution, but go ahead first.
Okay, then Klaus.
Thank you, Maran. Hey, I have a very simple question, Manu. What's your business model?
Business model is to go to the clinicians, B2B2C. So we go to the clinicians, offer these services, offer them to use our product to increase their revenue, our revenue, improve the quality and the outcomes, reduce the waiting times that have been available to the population, and probably grow it much faster, serving a larger population who have a waiting list of around 10 to 15 months at times, in countries, especially in Europe and Germany.
What's the age group you are serving? Because as far as I understood, you do very early assessment. Then for me, it's the questionnaire filled up by the kid that's most likely not able to read and write, or by the parents. Very, very basic question. And then you also support in the longer run. And just as a side comment, due to the fact that we don't have a lot of social interaction, a lot of kids that actually are predisposed to have something like autism also are now increasing in the severeness, just because they are not exposed in kindergarten or they don't have play dates anymore. So it's definitely a growing business, especially related to COVID. But again, I guess you also have a certain target group in mind, like an age group of people with autism that you want to treat.
Yes, absolutely. So this is, I'm sorry about it. I should have mentioned the age group targeting is between 2 to 5 years for detection, 1.5 years to 5 years for detection, and intervention between 2 to 6 years. It's very early detection and early intervention. So that's the focus. Yes, the COVID has really accelerated the symptomatic thing because of lack of socialization. The app and the solution is totally available for clinicians and schools and for parents to be a caregiver and improve the quality and the outcomes. Yes, but it doesn't require a child to interact with the app at all. So the child is not interacting with the app. It's enhancing the capacity of clinicians, schools, special schools, not-for-profits, and the parents at home as well under a clinical guidance.
Okay, thank you so much, Manu. And thanks to all the startups that just followed the pitches, or that gave the presentation of the pitches, actually. Also, thanks to the audience that were staying with us for the last 1.5 hours. If you want to have the pitch, we will put them on a cloud and the platform so you can have access to the pitches and then also get directly in touch with these 8 startups that just pitched. But we are not over yet. We will have a 15 minutes break, and then we will go into the pitches of the Tech for Good companies. And I will have with me different jury members, except Klaus, who's going to stay with me. But thank you so much, Ferdinand, for coming today, and Maren for asking these questions. It was a pleasure to have your inputs and also your sector expertise here with us today. So stay tuned, stay with us. In 15 minutes, we will continue with the next round of pitches.